Acupuncture is defined as the stimulation of a specific point on the body for the purpose of manifesting a physiological response that ultimately helps the body achieve a better overall metabolic balance. Acupuncture points are depicted in Chinese medical charts as connected by lines, referred to as meridians, that often overlie lymphatic vessels, blood vessels, and nerves. Acupuncture points are usually reflexively linked to distant sites, such as internal organs and other musculoskeletal structures. Tissue damage at these distant structures may be sensed as pain at the acupuncture point. When an acupoint is stimulated, there may be a release of endogenous endorphins, a change in blood pressure, or immune system stimulation. In traditional Chinese acupuncture, the acupuncture points are referred to as shu shui. Literally, the word shu means communication, and the word shui means hole or outlet. Hence, the traditional Chinese medicine nomenclature, acupuncture points were considered holes in the skin that communicated with one or more of the internal organs by way of meridians or channels of energy. If an internal organ was subjected to pathologic changes, the corresponding acupoints might become tender or demonstrate some other abnormality such as redness. By treating that acupoint, the theory is that the effects could reach the communicating organ, reestablishing metabolic balance and allowing the body to heal. From a more modern perspective, the phenomenon of lower galvanic resistance or lower electrical resistance than the surrounding tissues has been recognized at many acupuncture points. Unfortunately, this does not explain the location of all acupuncture points, so there remains a need for greater understanding of the differences in the tissues at acupoints. And though there are detectable differences in the skin over acupoints, during most acupuncture treatments, the needle is inserted beyond the thickness of the skin into the deeper subcutaneous structures. During manipulation of the acupuncture needles, when the tissue structures are stimulated, the acupuncturist seeks a sensation of the tissue grabbing the needle. This sensation is referred to as da qi and is considered an important part of achieving the therapeutic effects of acupuncture. Each acupoint has its own original Chinese name. The challenges of mastering the Chinese language drove Western practitioners of acupuncture to adopt the meridian numbering system of naming acupoints. In this system, each meridian or energy channel is named for a particular organ system, such as the bladder meridian or the stomach meridian. Then, each identified acupoint along the respective meridian is numbered. In this system, the number 11 point along the lung meridian is identified LU11. In veterinary acupuncture, the naming of acupuncture points follows a transpositional system. In other words, acupoints identified in a certain anatomic location on the human are transposed to the corresponding location on the animal. For instance, the acupuncture point named gallbladder 34 or GB34 is located on both the human and the quadruped in a depression, just distal and anterior to the head of the fibula. There are many methods described for stimulating acupoints. Dry needling is the insertion and manipulation of needles into acupoints. The length of the needles varies, depending upon the size of the patient and the depth of the acupoint. Once needles are in place, the needles themselves can have electrical energy passed through them, known as electroacupuncture. Electroacupuncture is commonly used for chronic pain patients and to prolong the effects of the acupuncture session. Likewise, heat can be applied to the needles, known as moxibustion. Liquids such as sterile saline or aqueous vitamin B can be injected into acupoints for aquacupuncture. This is a technique that can be used for animals that do not tolerate sitting still with their needles in place, or to complement more traditional needling. As well, injecting air into the acupuncture points is a technique called pneumoacupuncture. Non-invasive acupressure stimulates the acupoints without penetrating the skin. Veterinarians may teach their clients to stimulate acupoints this way at home between formal acupuncture sessions. Acupuncture points have a specific histological structure, That includes lymphatic vessels and capillaries, mast cells, nerve cells involved in pain transmission, as well as sympathetic nerves, and skin over the acupoint that is thinner and has reduced electrical resistance, greater electrical conductivity relative to the surrounding tissue. A majority of acupuncture points are located at motor points. A motor point is near where a nerve enters a muscle, and if a motor point is stimulated with electricity, it will cause maximal contraction of the muscle. A large number of acupoints are also considered trigger points, which are painful areas of increased tissue tension or spasm. Acupuncture needles inserted into trigger points can often cause the trigger point to relax, thus relieving or at least reducing pain. There is a population of acupoints that are located on the superficial nerves where they intersect the midline ventrally or dorsally. There are also acupoints located at areas that reflect a concentration of superficial nerves and nerve plexi. Finally, there are acupoints that are identified at the muscle-tendon connection where the Golgi tendon organ resides. When considering the diverse population of acupoints, it is clear that the majority of points intersect with and involve the nervous system. This makes sense when we think about the very diverse and varied physiologic effects acupuncture has on the body. Clearly, neurophysiology is at the core of acupuncture's activity in the body. There is as yet, however, no single theory of how acupuncture works that explains it all. One theory of acupuncture activity parallels the gate theory of pain postulated by Melzack and Wall. In simple terms, the concept is that if a nerve pathway consisting of myelinated alpha, beta, or delta fiber is stimulated by acupuncture needles, that stimulation can block or prevent conduction of pain sensation by unmyelinated C fibers. Another neurophysiologic theory of acupuncture activity postulates that acupuncture stimulation of the nervous system releases neurohormones, causing a myriad of effects throughout the body. One such neurohormone is beta-endorphin, an endogenous opioid. Several controlled studies have implicated endorphin release in animals treated with acupuncture. The mechanical release of trigger points and spasms by insertions of acupuncture needles is another mechanism by which acupuncture can relieve pain. Finally, acupuncture may also have effects by improving circulation within spasming muscles. The microtrauma caused by the insertion and manipulation of acupuncture needles may stimulate a cascade of events, including activation of the immune system. In most companion animal veterinary practices, acupuncture enjoys two major categories of application: pain management and geriatric medicine. Acupuncture has been described for use in the following pain syndromes: cervical pain, intervertebral disc disease, degenerative joint disease and osteoarthritis, and post-operative acute pain. In studies that have been conducted, acupuncture was demonstrated to be beneficial in cases where analgesics or anti-inflammatory drugs were either causing side effects or were not effective. Clinical experience will influence a particular practitioner's decision to add acupuncture to a pain management protocol or to rely on acupuncture as the primary treatment. The most common applications of acupuncture to geriatric patients include degenerative joint disease or osteoarthritis, chronic renal failure, congestive heart failure, chronic GI problems such as inflammatory bowel disease, immune-mediated disease, seizures, and general weakness.